Alive and Well STL is a presentation of the St. Louis Regional Health Commission and Rare Gem Productions to build a healthier St. Louis. Power up with the positive. Learn more at oneraregem.com. That's ONERAREGEM.com.
Support for Alive and Well STL comes from Beyond Housing, helps entire communities become better places to live. Learn more at beyondhousing.org.
The Regional Health Commission works in partnership with regional health sector advocates and stakeholders to improve healthcare access, reduce health disparities, and improve health outcomes for the uninsured and the underinsured in St. Louis City and County.
Alive and Well STL with Bethany Johnson-Javois, CEO of the St. Louis Integrated Health Network.
The city of St. Louis just made history by striking down Missouri's same-sex marriage ban. Despite the progress over the past decade, however, there are known health disparities and health outcomes within the GLBT community, especially when compared to the general population.
Wow, the first thing that comes to my mind is the recognition that we all are in this together, that we all make up the fabric that is St. Louis. That is what makes this region beautiful, why we are here. You know,
it's something to be celebrated.
Yeah, exactly. It's not something to be hurtful or hateful or spiteful. It's a mutual love that we have for each other in our differences that I think we need to find.
You know, I always say it really comes down to just showing dignity and respect. We can disagree on things, but still show common dignity and respect. And I think so often that's what we've lost.
So we've got some work to do in the region. We'll be right back. So Sherrill and Andrew, please, as your introduction to our listeners and to me, describe for us what it means to you and those that you serve to be alive and well in St. Louis.
You know, for me, to be alive and well in St. Louis is really about living my authentic life, being able to be who I am in my neighborhood, in my community, in our churches, and most importantly, in our healthcare environments. We need to be able to share with our doctors who we are and for them to respect us and treat us with dignity. So in order for us to really be alive and well in St. Louis, it's about having that dignity and respect, you know, every day in our lives.
Thank you for sharing that. What's your vision?
Yeah, I love that you said that, Sherrill, because that's immediately where my thoughts went to, because it's true. You know, to be able to step outside our doors and to be able to live our authentic life is huge for the LGBT community. And it's sometimes very much looked over by individuals as being a huge privilege for people to do. And so, you know, living alive and well means that we can be able to do that. And to be able to do that means that we need the legal and public policy support that has been lacking for so many years. You know, recently, like you had just seen, St. Louis City overturned its ban on same-sex marriage, which is fantastic. And we also had seen from that St. Louis County and Jackson County also started issuing marriage license. Though that's kind of in flux a little bit right now. We've got an appeal going on with Attorney General Chris Koster. But knowing that we have legal rights in the city of St. Louis and in those municipalities, I think, you know, shedded a huge weight from the community that we needed to since the installation of the ban in 2004. And so to be alive and well is to be able to live authentically without fear.
Alive and Well STL.
Good morning, St. Louis. Thank you again for joining us on Alive and Well. I am Bethany Johnson-Javois, CEO of the St. Louis Integrated Health Network and host of Alive and Well STL, sponsored by the St. Louis Regional Health Commission. Today we are joined in the studio by Sherrill Wayland, Executive Director of SAGE, Service and Advocacy for GLBT Elders, Metro St. Louis, and Andrew Shaughnessy, Manager of Public Policy of Promo. As we talk and think about what it means for our community to be alive and well, I am excited to be speaking with both of you, dedicated to the advocacy of GLBT equality in the state of Missouri and in St. Louis. Thank you both for being here and joining me today.
Thank you for having us.
Yes, thank you.
In the past decade, gay, lesbian, bisexual, and transgendered or GLBT individuals have made great strides towards securing equal rights. The city of St. Louis just made history by striking down Missouri's same-sex marriage ban. Congratulations on that.
Woot.
Despite the progress over the past decade, however, There are known health disparities and health outcomes within the GLBT community, especially when compared to the general population. So we've got some work to do in the region. SAGE, Metro St. Louis, and Promo are two local organizations dedicated to helping eliminate this health disparity gap and advocating for GLBT equality in St. Louis. What is the impact of having that ban lifted on the health and well-being of individuals?
Yeah, well, research shows that because of stigma, discrimination, and that lack of public policy support, that LGBT individuals and community members disproportionately are affected by negative health outcomes rather than our heterosexual peers. And this is cited in the Missouri Foundation for Health study in 2012, where it saw that more than twice than likely LGBT individuals will forego going to seek medical care. And that's a huge concern for us. Whenever we're talking about a community that is now starting to see legal protections, but is seeing the effects of all of that stigma and discrimination and history that we have come across. And so we need to start addressing the health of our community.
Sherrill, I'm hanging on to your comment about the definition of alive and well to be full, authentic, and respected. Can you walk me into the primary care physician's office and give me specific examples of which questions or lack of questions really help people to feel like they've been marginalized or to not feel like they're in a safe space to really talk about their health concerns?
Yeah, I oftentimes use my own personal life because it's an example that I can freely share. And, I think for me, about 2 years ago, I encountered some health issues. And when you walked into that doctor's office or talked to the receptionist on the phone, oftentimes the first questions were, are you married, single, divorced, or widowed? And even though my partner and I legally married 5 years ago in Iowa, up until October 3rd in the state of Missouri, we were basically still looked at as legal strangers. And so oftentimes you didn't know how to respond. And really out of my own fear of not knowing how this surgeon that I was going to see would, respond to the fact that I was a lesbian woman, I didn't know what to say when I was asked that question. So I said I was single. So oftentimes people, I think have felt like we had to lie about our relationships and about our lives in order to feel comfortable going into those healthcare settings.
And getting proper care.
Right, and ensuring proper care. Because, if you walked into a doctor's office who happened to not understand or to be homophobic, you could face mistreatment and outright discrimination in care. And we know that that's happened. So, the things that we encourage medical professionals to do today is just to ask those basic questions. What is your relationship? Who is caring for you? Tell us more about your family, your partner, and to be open to hearing, the responses that people share. And we know today that families come in all different sizes, all different makeups, all different colors, and so we really need to respect families for who they are and to ensure that the LGBT community feels comfortable in giving the information that we need to share in order to receive quality care. I know you had asked, how does marriage change, the picture of health? Mm-hmm. And, to kind of talk more about the legal aspects, we now know that same-sex couples who are married can now gain access to family medical benefits through employers. That is huge. So many folks were not able to get on their spouse's insurance plan. So you may have the person who's staying at home and caring for the children in the household not able to have insurance because they couldn't get on their spouse's insurance plan. That changes today.
Yeah.
We also have the Family Medical Leave Act, which now, LGBT families have full access to that. When I was sick, my partner couldn't take the Family Medical Leave Act. She had to use her vacation time in order to care for me. And we know that sometimes, you're down to 1 or 2 vacation days. And so that can impact, the quality of care that an LGBT family is receiving when the spouse can't be there to care for their partner.
And not only that, but with birth certificates, being able to be put on a child's birth certificate that you are their legal parent. As an LGBT individual, that didn't happen. We were denied that. And today we're able to do that. So it's a huge, overwhelming feeling, to be honest with you, as I think about it, talking to you all. I know that from the promo perspective, when Wednesday happened, when the marriage ban happened, when we saw that, I don't think there was a dry eye in the house. And so that's the effect it has, really, truly. And studies have shown that, marriage has a benefit to the health of our community, overwhelmingly. And we see that in research. And so to have denied LGBT people that ability has really significantly caused a barrier in their health.
So, Andrew, can you help me to dig deeper into the statistics? We've had a high-level picture of health, and you're also talking about the emotional, social affirmation in addition to the physical aspects of health, which I appreciate both of you talking about. But in terms of specific populations, what are some of the health statistics around the African-American GLBT community or young people, or my own soft spot for elders, which your organization helps to promote advocacy for? How are the statistics different or similar in terms of those groups of people?
Well, keep in mind that with LGBT individuals, we are across all spectrums, socioeconomically, nationality, everything. We span all ethnicities. And so keep in mind that with that, oftentimes those minorities also feel the pressure of feeling double minority, where they have two double minority statuses. So for instance, we use a lesbian African-American woman. Well, there you have three minority statuses. And so those compound upon each other. And so those individual people feel all three of those, just to give an example of that. And so I think that overwhelmingly there is, health concerns for these populations. The unfortunate part is that there really isn't much data to back up our findings. And that's part of our problem, is that we're seeing research and we're seeing glimpses into these communities, into our population. I keep referencing the Missouri Foundation for Health 2012 Health Equity Study. And that was instrumental for getting this work started here in Missouri. And so we really do need to collect more data and be reticent of this population in order to really address the health concerns that come up. So whenever we talk about statistics, we only have little glimpses into these communities. Part of the problem with the African American community, the LGBT community, is that oftentimes our feeling of invisibility, and I'm a white gay man, oftentimes is doubled. As LGBT people, we have oftentimes felt invisible because we have to come out in order to be visible. That's why we have prides, and that's why we go and celebrate every summer across the state. But unfortunately, for some, that simple act of coming out is difficult. And so we don't really have a great glimpse of what the health is like of the African American community because of those barriers.
And I would add to that, it's not only difficult to come out, but sometimes it's dangerous for people to come out. We know that victimization of, LGBT people continues to be a high concern. And so that's another health risk, being victimized because of your sexual orientation or your gender identity is another issue that we need to be addressing as a public health issue.
Yeah, and bringing it back to youth, disproportionately, overwhelmingly, and as a youth who grew up in Missouri and went to public school in Missouri, bullying is an issue. And it has unfortunately come to the time where we're seeing our youth commit suicide because of the immense amount of bullying they experience in schools and the lack of support that they do have. And so, for youth, it's simply about trying to live day by day in hopes that they have a family that supports them, because oftentimes we see high rates of homelessness within our youth. I think I heard a statistic over in Kansas City, and this might be anecdotal, about 40% of their homeless population is LGBT youth. That's a huge concern for us because homeless individuals experience negative health outcomes. We all know that. Research backs that up. And so, youth is something that we all have been trying to focus our attention on and trying to address in our schools.
You talked about missing data elements. What data should we be demanding that we have that is standard practice that we're collecting across the system that is not in our information arsenal now?
So all health and social service organizations should be asking their clients or their patients their sexual orientation or gender identity statuses. We need to be actively asking individuals and not be scared to do so. You know, oftentimes the barrier comes up whenever we look at that intake form and we see those non-inclusive assumptions right off the bat. But if you include those questions, it oftentimes triggers in us, okay, this could be a welcoming space for me. Like, these people are really interested in getting to know who I am and seeing me not as a patient, but as a human being. And so we need to empower our health and social service organizations to include data collection for this population. I think that's one big thing.
What do you think?
Yeah, I agree. And we know this is, work is being done at a national level to help include data on all national health surveys that come out of the Office of Women's Health, the Office of Minority Health, HHS, so that work is happening. And when we start to collect that data, then we can have a better picture of, what are the health disparities? Where are the gaps in the healthcare for the LGBT community? So it's critical that we start to collect that data so we can really do the work that needs to be done.
Data is used as the voice for advocacy and for change so many times. So your point about invisibility really connects with me in terms of what you're saying. You mentioned earlier the Missouri Foundation for Health report entitled Health Equity Series. I think in 2012 was the time frame. Within the report, the author noted the average medical student spends fewer than 5 hours, its entire curriculum, fewer than 5 hours learning about LGBT health issues. How are advocacy groups and organizations addressing this kind of issue, or are they addressing this kind of issue?
Well, to add to that, you forgot one key thing. So 5 hours of learning, and it's significantly dedicated to HIV and AIDS. Okay? That's a little bit of the problem.
Okay.
Because for LGBT individuals, we have been seen as the community that has gone through and experienced HIV and AIDS.
High risks
of HIV and AIDS. And that is only but a small piece of the huge puzzle that makes up the health of the LGBT community. And so stereotypically, that's where medical schools have gone. But the Missouri Foundation for Health report showed that we need to actually be addressing a lot more than just HIV/AIDS in our community.
Yeah, and I think, up until this point, we've really, been trying to play catch up. So we know that medical personnel, doctors, nurses, gatekeepers, receptionists, the medical profession has not received cultural awareness training. And so we've really been playing catch up and trying to go in, after people have been working in the field for 20 years, have been serving LGBT folks this entire time, but have never really been taught, how do we communicate with our LGBT patients to ensure that they feel comfortable and welcomed. So we're playing catch up. However, this past week, the American Association of Medical Colleges just made an announcement that they have developed free curricula guides that will now be available to all medical educators so they can start including this, very important information into the medical schools and then into the training programs for our healthcare system. Within the aging system, we also have the National Resource Center on LGBT Aging, who, they've been working the past couple of years to help ensure that there's also this type of cultural awareness training available for health and social service agencies serving our LGBT elders. So, really education and training is critical.
And I'm going to plug a little bit Sherrill's program that she has going on, which is the Missouri LGBT Health Access Training. And this is part of the collaboration that you see with Promo and Sage Metro St. Louis. And from that training, it prepares health and social service providers to be able to be cultural competent around the LGBT community. And so we've been actually quite successful this year. Sherrill, would you like to continue to talk about that success?
Oh, go ahead and build me up. That's great. We've trained, I think we've had over 50 training sessions just this year, reaching over 1,600 providers. And I think what's, really exciting about that is we were able to provide webinars to the SSM healthcare system. And that included not only hospitals in Missouri, but Wisconsin, Oklahoma, Missouri, and I'm blanking.
Illinois.
Throughout the 18 hospital SSM network. Yeah.
So we had over 1,000 SSM employees that attended these webinars, and it was very successful. The employees actually asked for more. So, I think that's a true sign of that our health providers, they want to be more competent. And we owe it as health professionals to make sure that our employees have the information they need, the training they need to really serve all who come through their doors.
Yeah, and for promo, we are continuing to look at the public policy of health and social service organizations. And so we're making sure that they have LGBT welcoming policies included in their organizations. And so what do I mean by LGBT welcoming policies? So what that means is that we want to be able to identify hospitals that have patient and employee non-discrimination protections that are inclusive of sexual orientation and gender identity. We want to have a visitation right that explicitly grants LGBT families and families of choice the opportunity to see their loved one while they're seeking care. And the other one is specifically around training and making sure that we do have health and social service providers that are trained. And we are excited to have announced, because of this work that we have been doing, in 2013 on the Human Rights Campaign Healthcare Equality Index, which is an index that rates hospitals nationally. Missouri ranked 37th. And in 1 year, in 2014, we jumped from 37th to 6th in the nation, beating out Illinois, beating out Pennsylvania, beating out these, stereotypically very supportive areas for us. And so we are empowered by that work. And when we see that our work is truly making a difference, which I think continues to show the momentum. And so we have 19 leader facilities here in Missouri that have all of the policies to be LGBT inclusive. And that is huge because we continue to still live in a state where the legislature continues to deny basic protections. And what I mean by basic protections is that unfortunately here in Missouri, LGBT people can still be fired from their job, denied access to housing and public accommodations. So it's critical in order to break down that barrier for LGBT people to include these welcoming policies.
And it's critical for us in order to build a healthier St. Louis. So with that being said, I'm interested. I thought about this last night in prayer, literally. Taking a quote I heard this week, it's common knowledge at this point that I have been part of the Ferguson Commission. And one of the main comments that was made that really opened my heart to possibilities here in the region said, we don't have to see eye to eye to walk arm in arm. What is the common ground that we as a region must reach, regardless of conservative and liberal ideologies that will close not just the health disparities gap, but the humanity gap? What work do we need to do? Because that, for me, is the bigger picture of all this.
Wow. The first thing that comes to my mind is the recognition that we all are in this together, that we all make up the fabric that is St. Louis. That is what makes this region beautiful, why we are here.
It's something to be celebrated.
Yeah, exactly. It's not something to be hurtful or hateful or spiteful. It's a mutual love that we have for each other in our differences that I think we need to find.
And, I always say it really comes down to just showing dignity and respect. We can disagree on things, but still show common dignity and respect. And I think so often that's what we've lost. And, I think as minority groups, we can come together from that common ground of dignity and respect.
I think restoring the ability to love through listening, again, is a really important part of that healing process. this whole season has been focused on addressing and being aware of trauma and trauma-informed care communities. And this topic really encapsulates the essence of trauma and the essence of what healing really needs to look like. So I appreciate your perspectives on that. I jumped the gun on a question because I was feeling it, but I'll go back to this other important one too. How do we, in your opinion, close the gap of health and wellness within the GLBT community? I don't want to forget that point.
I think it's really a three-pronged approach.
Okay.
One, we need to educate and empower LGBT individuals. We know that we definitely have disparities in our health. And so we need to educate our community. What are those disparities? And empower our community to take better care of ourselves, to find friendly doctors and go to the doctor and be active participants in preventative care. Second, we have to train our health providers. We have to encourage and, in some ways, enforce welcoming policies and non-discrimination policies. And, you know, we have to continue to build upon the cultural competency and cultural awareness to ensure that LGBT individuals and their families know that we have healthcare systems that care about us and are here to serve us.
Yeah, and I think one of the things I would like to add to that, because that is all fantastic, in order to close the gap, I feel like the LGBT community needs to get out of a place of invisibility. That we need to, like Sherrill said, be empowered in our healthcare settings to come out to our doctors, to find doctors who are friendly to come out to if you need that. Definitely. And so creating those environments is so critical in order for these individuals to do that, in order for me to feel comfortable. Because just like Sherrill, I've had my instances where I've been in a healthcare setting and I've not outed myself, where I've hidden. And believe me, as an LGBT advocate, you think about that all the time because you're put in a position of privilege to be the voice of the LGBT community. And it's difficult whenever you're put in a position where you have to hide your own self. And so, sorry, I'm getting a little teary there, but we have to recognize that we are everywhere. You know, I grew up in St. Genevieve, Missouri, an hour south of here. I came out in a public school setting and was treated like most LGBT youth in rural Missouri to a lot of bullying, unfortunately. But I think for rural Missourians, it's important to be recognized by their healthcare settings because oftentimes we're not. And that becomes the problem. And so, yeah.
I really appreciate you saying that. And for listeners, even if you can't connect to the specific kind of struggle, connecting to the pain of invisibility is something that everybody at some point in life has felt. And that common space is what makes me feel like I have the need to step up, to advocate and to see differently and to think differently and to think more unified. So I understand from the perspective of putting yourself out there to have to be the lone voice, sharing your lone perspective, it feels like, and the pain that then becomes the reward for doing that.
Well, and also, you know, whenever you're talking about elected officials and people who represent us in those rural areas who continue to deny that the LGBT community exists, it's difficult whenever I did grow up in a rural part of this community. And like we know, and we've seen it time and time again, actually there's census data to back us up, that LGBT people are in 99% of the counties in the nation. We are everywhere. We are everywhere. And so as health and social service providers, we have to recognize we're everywhere and then do something about it by changing policies, by educating. And once we get over that hump that we are seeing LGBT patients, I think it starts to open the doors for that. And so we have to recognize that we are everywhere.
In closing, as we wrap up, is there anything else that you would like to share that listeners need to know that perhaps they never thought of or need to think about differently?
That love is love.
You know, I think it really does go back to recognizing that we're your family. We're your brothers, your sisters, your moms and dads, and yes, sometimes grandma and grandpa. We are your families.
Very powerful. So Sherrill and Andrew, thank you both for joining us. Thank you for the work that you've done. Thank you for your presence, for your authenticity, and for your voice. Really appreciate your time and the genuine compassion that's oozing through these microphones for our listeners today. And for our listeners, allow yourself the opportunity to be open and to allow love to take over any other concern or issue that you've got, combating that as you listen to this show today. This is the work that we're called to do in this moment. Thank you so much for your time. And thank you everyone for joining us for another episode of Alive and Well STL. We look so forward to speaking with you again next week. For more information about today's program and to become involved in Alive and Well STL, download the smartphone application Bonfire, Bonfyre, and search for Alive and Well, or visit us online at aliveandwellstl.com. We are grateful for your gift of time to this conversation. We encourage you to stay involved and get involved.
You are invited to join the conversation. If you, your family, or your organization is interested in talking about how we better the well-being of the region, sign up for more information, join the conversation, log on to aliveandwellstl.com, and let's build a plan on how we can work together and improve our overall health and become alive and well. The Regional Health Commission with Chief Executive Officer Robert Friend Jr. committed to providing a detailed review of change over the past decade in 14 leading health indicators for the city and county of St. Louis. The first decade review of health status report, an update to building a healthier St. Louis. Discover the narrative, the data, and celebrate the progress already made to improve healthcare access and reduce health disparities in our region. Learn more at stlrhc.org. Alive and Well STL is another positive production of Rare Gem Productions. Thanks for listening.